Contemporary culture prizes certainty. We value definitive answers, clear plans, and measurable progress. Institutions, workplaces, and self-help industries alike promote confidence as a marker of competence and control. Yet beneath this craving for assurance lies a paradox. The more we demand certainty, the more we narrow our thought, constrain our curiosity, and reinforce defensive patterns that limit growth. Embracing, not knowing, is not an abdication of responsibility or retreat into passivity. It is a deliberate stance, psychologically sophisticated and pragmatically powerful, that frees cognition, expands possibility, and fosters deeper resilience. Psychologically, the intolerance of uncertainty is implicated in anxiety disorders, perfectionism, and rigid interpersonal strategies. When individuals equate not knowing with threat, they mobilize avoidance, hypervigilance, or premature closure, rushing to decide, defend, or label in ways that reduce ambiguity but also curtail adaptive learning. Conversely, cultivating comfort with uncertainty can dismantle those defensive routines. It reduces the urgency to protect identity through certainty, allowing people to explore, to revise beliefs in light of new evidence, and to tolerate discomfort long enough for insight to emerge. This shift is not merely intellectual, it is somatic and effective. Tolerating ambiguity downregulates threat responses, enabling cognitive flexibility and creative problem-solving. At the level of knowledge production, accepting not knowing counteracts the illusion of explanatory completeness. Science itself advances by recognizing gaps, formulating questions whose answers are provisional and contingent. When clinicians, researchers, or thinkers acknowledge the limits of current models, they open space for novel hypotheses, interdisciplinary collaboration, and methodological innovation. For practitioners in psychotherapy or neuroscience, this posture prevents reifying diagnostic labels or treatment fads and promotes humility, iterative assessment, and personalized care. Embracing uncertainty thereby becomes an ethical imperative. It prioritizes patient-centered inquiry over simplistic certainty. Practically, adopting a stance of not knowing entails several interrelated practices. First, cultivate epistemic humility. Explicitly mark conclusions as tentative and remain open to disconfirming data. Second, reframe uncertainty as an affordance rather than a deficit, an invitation to experiment, ask better questions, and iterate. Third, develop metacognitive awareness. Notice the urge to resolve ambiguity prematurely and trace the beliefs or anxieties fueling that urge. Fourth, practice structured exploration, small, low-stakes experiments, hypothesis testing, and reflective journaling, to translate openness into disciplined inquiry rather than passive drift. The benefits of these practices are substantive. Intellectual growth follows from encountering and engaging with contradictory information rather than filtering it out. Emotional resilience increases when individuals learn to sit with discomfort without collapsing into reassurance seeking. Interpersonal relationships deepen because curiosity replaces defensiveness. Asking genuine questions conveys respect and invites reciprocal vulnerability. In professional domains, teams that tolerate uncertainty innovate more effectively, since they are likelier to iterate, pivot, and integrate diverse perspectives rather than cling to a single, comforting narrative. Of course, embracing not knowing is not universally adaptive in the same form. Some contexts demand decisive action, emergency response, certain legal or managerial decisions, where prolonged ambiguity is dangerous. The skill lies in calibrating tolerance for uncertainty to the stakes and timeframe at hand, suspending judgment long enough to learn when possible, deciding expediently when necessary. Moreover, social and structural inequalities shape who can afford epistemic openness. Marginalized individuals may experience uncertainty as existential risk rather than intellectual curiosity. Thus, Cultivating this stance must be sensitive to context and accompanied by structural supports. Ultimately, the wisdom of uncertainty reframes ignorance not as a failing but as a fertile condition. It shifts the moral grammar of growth from proving oneself right to becoming better informed, more adaptable, and more humane. For audiences attuned to psychological complexity, those familiar with the anxieties and neurotic needs that steer human behavior, this perspective offers a constructive paradox. By relinquishing the compulsion to know, we gain access to richer, more authentic forms of knowing. Embracing not knowing is a disciplined courage, one that transforms anxiety about the unknown into a steady engine of learning, creativity, and connection.